morning, everybody. It's my pleasure to address such an esteemed audience, and thank you for considering me for my views. So, I'll try and give all of you a perspective on what I think is happening to the healthcare and what changes will happen. Some of them may happen maybe sooner than what I think, or maybe later, but the trend is unmistakable. It is going to happen. And before we go into details, let's just talk about why we are talking about the changes. We have not talked about changes in healthcare for decades. And all of you are aware that the way we have delivered healthcare in the world, not in India, in the world, has been exactly the same way. What you have done 50 years ago, 100 years ago, 200 years ago. So now there is a transformation, and we all know that these changes are driven by the pandemic. Now, what happened in pandemic, and just to take a second on that, is that in pandemic, what came out was that our healthcare infrastructure is completely inadequate to meet the demands of the population of the country. And so that meant that now what was not known to the patients, not known to the population, is now visible to all. So now, once the problem is big and staring, we have to have a solution, and we found a solution. And the rapid advancement of technology in the last year or so has also enabled a lot of changes in healthcare. So I am going to talk a little bit about the what we have heard about the digital healthcare and what it means, and then we'll talk about other things. So, the globally digital healthcare is it includes telehealth, it includes m-health, electronic records, it includes remote monitoring, it includes analytics, and so on and on. And it is expected that it will be around $485 billion by 2024. That will be the size of the market, and it is growing at 27% on an annual basis, CAGR. So obviously there is a lot of growth and there is a lot of potential in this market. So why it is happening and what it is. Now, if you just take a bit of that and translate it into India, in India, health tech is expected to be around $50 billion, maybe in another 10 years. So let's say 2033, which will include, there'll be a component of e-pharmacies, there'll be a component of B2B health techs, B2B of logistics and supplies, video consultations, and other things which I talked about, the mobile health, and so on and on. And one example of that, you've also seen in the last year or so, the government of India, when they liberalized the tele-consulting guidelines, the e-Sanjeevani project by the government has already delivered healthcare to more than 1 crore people in the country. And they are doing almost 75,000 to a lakh per day. Now, imagine this was not being done before. So the technology is already giving access to a lot of population in the country. And the other things which happen in technology, and I'm not shy at saying this, is that healthcare has always used technology for equipments. But to use technology for delivery and other aspects, we've been a little laggard. So think about it, that before last year, how many doctors and professionals used teleconsultation? Not many. So, but now in the last year or so, more than 85% clinicians have used teleconsultations. They've had, many of them are first timers. Around 40 to 50% patients are from non-metros. So what we like to believe that technology exists only in urban areas or metros, not exactly true. And many people have found it effective. More than 50% have found it effective. Now, this was from a study which was done by BCG and FICCI last year. So I'm quoting from that. The other driver to this, what is happening is the investment in the country, the private equity investment. And money follows wherever there is an opportunity. So if you just look at the trend, around $1.3 billion has been invested this year by private equity till August in the healthcare space. Now, obviously something is happening. And combine it with the government's push on digital with the Ayushman Bharat Digital Mission, which used to be the NDHM, which talks about creation of the healthcare ID, the professionals registry, the hospitals registry, and the electronic records. Now, some of my friends will say, it's not going to happen now. Records may not happen now, but at least if the ID is created, if the registries are made, it is a step in the right direction. It's a question of time when some of us, or maybe all of us, will be able to access all our medical records online with a unique ID, irrespective of the facility where we go to. So it will mean that if I am in town A, I go to town B, my records travel with me. Now, what does it mean? It means that the person who is the clinician who is giving me a consult in town B has access to my full history. So, probably the clinical decision making will be better, maybe more informed, and I have control. So, the control over health is moving from a hospital and a doctor to patient owning their own record and deciding where to go. Now, what does that mean? If you look at the society as a whole, our patients are also behaving in some manner as consumers, in the sense they are well informed, they like to discuss, and they like to evaluate various options before taking a decision. And this growth of technology is really helping them do that. Now, if you take all this and translate it into a hospital space, what does it mean for a healthcare provider, for people like us? What it means is something very easy to understand, that this helps us expand our catchment area. For example, in our Hinduja hospital, we have done teleconsults or video consults for patients who are from more than 260 cities in the country in the last year or so. What that means is that patients who are not able to come to the hospital, I am able to provide some kind of a consult to them. Now, this is amazing. And imagine the person who is sitting in a far off town, he can access the best of the doctors across the world, across the country, with a click of a button. So I think that's a very pro hospital. And all hospitals have adopted it completely. So that's a great thing. The other thing is, when you give some kind of a digital platform, and if you give a registry and you give an ID, the moment you give that, it leads to what we call as dynamic pricing. It gives a choice to the patients that you will go to wherever you think is appropriate, and there will be a filter of quality and value-based healthcare. So I think that is a change which is going to happen, and all hospitals need to be ready with that. Now, just from the efficiency point of view, if everything is digitized, it also helps in improving efficiency of the hospital. Inside the hospital, what is happening? Now look at the journey of the patient from before they enter the hospital to throughout the hospital stay and outside the hospital. So more and more what we are seeing is that what we call as IoT, the devices are being linked, the sensor-based technologies are there. Now, what does this sensor-based technologies do? What it means is that earlier, if there were 4 nurses required to manage a ward because they have to go physically from patient to patient, maybe we can manage with 3 or 2 nurses, where all the nurse stations have to have is a standard monitor where they are monitoring the vitals of each and every patient, which is through remote sensing across all beds, and they know where to go. So this helps increase our, the kind of care we give to our patients and in time. The thing about this is, what will it do? What will it do to the care? See, today we have what I call as reactive care. But I think this will lead to what will happen is proactive care. So when somebody sees the parameters and vitals in advance, they know and they can reach or they can predict, and you can provide care in advance of earlier. This will also help mobilize our resources, because if you have sensor based, you can do sensor based tracking on the equipment, on the trolleys, on the wheelchairs, and maybe some people can use the sensors. So you know exactly where each equipment is, you know where each wheelchair is, you know where each patient is, and then you can schedule their appointments, like how we've been using that in one of our areas, where we know exactly where each patient is, and we schedule their appointments and health check accordingly. So I think it's amazing because it doesn't, it utilizes all the resources effectively, and also the patient's time doesn't get wasted. And patients are generally happy with this better improved patient care. And we all know the challenges in the country, that we have less number of doctors, less number of nurses, less number of allied staff. So the more and more we use technology, and more, suppose we can do remote monitoring, like I said about this, or if I can have a remote monitoring of the ICU. So the more I do that, I can manage with less resources. And in a country like India, where resources and number of professionals is a challenge, this will be a great help. And we've been employing in examples of that. A simple example of this. And what I believe is that technology doesn't have to be very complex. Even simple applications lead to greater discoveries. For example, in COVID, we all know that the patient's relatives were not allowed to go into the patient wards. Now they need to talk to them. Simple thing, use an iPad at both ends. So the same technology and simple application is used for remote ICU monitoring for complex cases, of course, with a different aspect, more vitals monitoring and so on. So that, I think, is happening in the healthcare space. The other trend we are seeing in the hospitals, and all of us are seeing in the society, that what COVID did for all of us, it showed us that the health is very important. The economy shut down, the offices shut down, the roads shut down. We knew health is the most important aspect. Health is wealth, what we've heard. So based on that, there is a lot of focus now on preventive health by people. So people are using wearables, people are exercising, people are going for preventive health checks. So what this is leading to preventive health care. And if you hold that thought for a minute, so all these things are changing in the hospital environment, in the society, but what can derail it is the number of people are less, number of beds are less, the infrastructure. So what we can do, and I'm giving a specific example, and this is my suggestion to, if there are some decision makers listening to this talk, my request to you is that we need more nurses. And there are many nursing colleges which do not have enough admissions. So my request is, please create better employment opportunities for nurses in the country, so that more and more people are, willing to join nursing. Also do changes for nurse practitioners, so that, you don't put all the load on the doctors and on the nurses. The other thing is that hospitals, of course, need to get some incentives to train allied healthcare and so on. And my favorite is reverse brain drain. The way when we can, if there is a way to get people who are abroad, Indians who are medical professionals, nursing professionals, to come back to India and provide them some incentives, some special facilities, so they can come and serve the country. I think we can do that. I think a large scale use of AI and ML to do mass screening across the government programs in rural areas, in semi-urban areas, where you do the screening and that can be monitored by urban centers, where there are doctors remotely monitoring it, and then you filter it out and get the cases for, through you cascade primary, secondary, tertiary healthcare, and you get them to the center where they need to be. I think that will be a great thing, and is also leading to people adopting more and more insurance. So the more and more people take insurance, and with Ayushman Bharat, 50 crore people will be insured in some manner, there is a need for better healthcare. There's a need for better technology. And unless we adopt technology, we are not going to be in sync with what the world wants, what the patients demand. And I am a firm believer that a patient in India is exactly the same as the patient in the US, or exactly the same as a patient somewhere in Europe or Australia. So they are entitled to the same level of care. They are entitled to the same level of equipment and technology. And there is no reason why we should not provide it, especially now that globally we are all connected. And with all these changes, I think there is a time has come. This technology will help us. See, today, hospitals are for sick people. So we are in healthcare, but essentially we are in sick care, taking care of people whose health is not okay. I think the way technology is transforming itself, and what I've just discussed in the past few minutes, I think this is the time when hospitals will truly transform from sick care to healthcare, including preventive healthcare for the community. And I'm very, like I say, I'm very bullish on the sector, and I'm very glad that I am in this sector at this point in my life and this point in India. Thank you so much.